Good morning, everyone. Welcome to January's version of the 8-part learning series of the Utah School Mental Health Collaborative. We here today have our team from the UTech Lab that houses the Utah School Mental Health Collaborative. We, the UTech Lab, are a technology in training, education, and consultation lab housed within the College of Education. Let's take a minute to go around and introduce our collaborative team. I can go first. My name is Dr. Shatriya Latherma Wood. I am the postdoctoral fellow in the lab.
Hi, I'm Derek Smith. I'm the staff psychologist in the lab.
Sorry, I was getting an email. I'm Molly Davis. I'm the social worker and supervisor for some of the grad students.
And I am Jocelyn Kazar-Kurama, and I am the project development assistant in the project.
All right, thank you everyone for that. So first, we want to give a big shout out to the organizations and institutions. Some of this work would not have been possible without the support from our funders and collaborators. Our funders and collaborators include Cambia Health Solutions, HMHI, Huntsman Mental Health Institute, ULEAD from Utah State Board of Education, and Utah State University. The content for today's training was developed by the Mental Health Technology Transfer Center Network, we also call MHTTC, and the National Center for School Mental Health, which we call NCSMH. The MHTTC network hosted an 8-part learning series or a training series using the National School Mental Health Best Practices Implementation Guidance modules for states, for districts, and for schools. This resource was developed by MHTTC Network in partnership with the National Center for School Mental Health. And the whole purpose of this series was to help states, districts, and schools advance comprehensive school mental health and engage in planning for implementation of school mental health work. Also, the primary intended audience for this series is districts, school teams, and community behavioral health providers who not only develop but also help oversee school mental health systems, let it be class-wide, building-wide, and also school-wide. So here on this slide, you see two different manuals. One is the trainer manual, and one is the participant manual. So this is what I mentioned, the guidance modules. This resource actually contains 8 sets of slide decks for each module in the curriculum. And it represents all of the core features of a comprehensive school mental health, which I will talk to you about in the next slide. If you are interested in retrieving this curriculum, please do send us an email and we will be happy to share with you the link. But for the time being, I will also drop the link on this chat so you can go ahead and sign up for that. So these are the different modules that I mentioned to you earlier. And this is what makes up the implementation guide. So in this series, we have so far covered foundations of comprehensive school mental health, teaming, needs assessment, and resource mapping. And today we're going to talk about screening. So if you did not have a chance to attend that session, you can find the recordings for all of the previous 3 sessions in the Utah School Mental Health Collaborative website. And let me also quickly drop that link so that you can access that. So that way you won't miss anything. So today we will kind of quickly recap screening within schools. And this is actually one of my personal favorite topics, and spend the rest of the hour kind of opening it up for discussion to identify and explore what screening really looks like in your school or even your district. In the other months that will follow, we will review the rest of these topics that are listed here. So mental health promotion, which we will do next month, early intervention and treatment, funding and sustainability, and impact. Okay, so before we do go ahead and get started, a really quick disclaimer. The opinions expressed in this learning series are the views of the presenters and do not reflect the official position of the Department of Health and Human Services or SAMHSA, the MHTTC network, and the National Center for School Mental Health. There is no official support or endorsement of the HHS, SAMHSA, or opinions described in this document is intended or should be used or should be inferred. So for a few minutes, I'm going to share some of the highlights from this module as kind of a refresher, but I do want to remind you that the full module recording is available through the MHTTC website and can be accessed through the flyer that we have sent you as a reminder of this to register for this session. So this module is titled School Mental Health Screening. And in the next slide, you can kind of see what we're gonna discuss today. So we'll kind of speak about the definition, like what does it mean to screen? Some of the impacts or like the purpose. So why do you have to screen? This is probably not something new to most schools, but you know, different schools, again, like I always say, different schools at different places. Some are thinking about screening, some have already implemented screening, some are kind of rethinking about how they want to repurpose their screening. So these are all good places to be at. We'll also speak about some screening action steps, and that's where kind of bulk of my recap will be focused on. And that kind of like speaks about how do you like lay out a plan for screening. Some common barriers and strategies to address those barriers, and also surveillance screening as an option. All right, so what is school mental health screening? I'm gonna give you a couple of seconds to read off this slide that kind of captures the definition of the overall definition of screening. Okay, so think of screening as a tool, a screener as a tool, and the process of using that tool as screening. And it can be employed by an entire population. So typically when you say entire population, it doesn't have to be an entire school. It can be an entire grade, an entire classroom. So again, depending on where schools feel comfortable that, you know, they can accommodate screening. So school mental health screening, you know, we also sometimes call it universal screening because we eventually want to screen all students, but there's always a place that we have to start. And screening, you know, is not just used to identify individuals who are at risk or who are experiencing risks, but they can also be a tool to identify students' strengths and some of like the benefits that they're experiencing and the positive things happening in their lives. So when I say risks, some of the things that we want to target include risks for social, emotional, and behavioral difficulties. But screening also can be used as an early identification strategy. And that kind of helps you identify the onset of challenges. And that way schools are in a much better position to be prepared way ahead of time to prevent any escalations or any intensified behaviors in the future. So screening, like I mentioned, screening sometimes focuses on, you know, strengths, sometimes it also focuses on risks, and it can also focus on both. But typically, if you think about overall kind of what screening tools capture, students are being asked about indicators of well-being and positive mental health. Like what are some, like I mentioned before, what are some great things that are happening in your life? What are some strengths that you have that really help you navigate your day-to-day? They ask about life satisfaction, school belongingness. Do you like to come to school? Do you have peers? Do you feel like you have someone to rely on? Like, are your teachers friendly? Can you trust them? So those kind of like encompass how a person kind of perceives belongingness in the school. Social determinants of mental health. And here I have included an image that kind of captures some of those social determinants of mental health. So education and access and quality. So think of all of these as very equitable determinants, right? Healthcare access and quality. Your neighborhood, your environment. Do you feel safe where you live? Do you have access to food, shelter, clothing? Those kind of like capture economic stability, social and community context. So like, again, where do you live? Those all kind of compass social determinants of mental health. And also adverse early life experiences. So traumatic experiences that may have, that our students may have experienced that definitely do trickle down and impact them on a day-to-day. So, you know, we talk about screening, that we want to do screening and almost we have to do screening to be proactive and make sure that we are taking care of our students and providing all that we can. But really, why do you screen, right? Of course, it is the right thing to do. And we are able to identify individuals who may experience or again, be at risk for experiencing social, emotional, and behavioral difficulties. But it doesn't stop there. There's actually, you know, a bigger picture, and it takes a direction of being, again, more proactive. So there are many reasons to conduct mental health screening in schools. So I'm going to give you a couple of seconds to read off this slide, but I'll kind of elaborate on each of these different points. All right, so the first one is support a multi-tiered system of supports. So think about the MTSS framework, you know, all those beautiful ratios per tier that we worked so hard to maintain. So screening can actually help you maintain your framework as recommended. So it can, if you think about it, it can really promote comprehensive school mental health strategies, not only across, you know, the tier 3, but also across all of the tiers. And as a result, you have the appropriate supports distributed equitably along all of those tiers. Currently, you know, there's, again, schools are in different places, and some of the common things that we see is a lot of emphasis is placed on tier 3. So what happens is eventually the caseloads for school professionals increase. And a lot of focus or emphasis is placed on providing like this one-on-one, or, you know, if there's suicidal ideation, homicidal ideation, there's a lot of kind of a band-aid approach to kind of like help put out fires. So it can be very taxing on our school mental health providers. So something to look at would be, how do we take all of these resources that we have? This kind of maps back to resource mapping that we spoke about last month. What are the resources that you have, and what are the needs that you have, and how do we strategize to distribute all of those equitably across all of the tiers, so all of our students are being benefited, not only those who are currently experiencing challenges, but also maybe those who are at risk, and you kind of see those developing. So if you do this, then, you know, there's appropriate supports accessible to all students. So the next one is inform prevention and early intervention strategies. Now, when you do screen students using very specific tools, you're actually asking them what has worked and where they need help. And, you know, this may seem like a very foundational thing to do, but in all honesty, it yields extremely valuable information, again, to be proactive and also kind of help in your planning for how you want to prevent and intervene on these things. Now, schools may choose to do their screening in ways that work for them. For example, you know, if screening reveals high levels of student stress and anxiety, then something that schools can do is have or teach coping skills to help reduce anxiety. And that may be a helpful strategy to, you know, implement in classrooms, speak with your teachers, speak with your paraprofessionals. So having that data kind of helps you do a lot of preventative work on the front end and kind of prevent, again, kind of the band-aid approach. The next one is identify concerns to specific grades, classrooms, or educators. Now, when you talk about screening, especially for schools, Some of you maybe have heard about screening. Some of you may be new to the idea of implementing it, and it can definitely sound very overwhelming. And partly this comes from the idea that you have to screen the entire school in one time. Again, this goes back to different schools and different places, but the most important thing is to recognize that schools have different resources and different supports. And therefore, it is okay for schools to start small. And when I say start small, again, think about a single grade, think about even a single classroom, because this will kind of help identify the very targeted strengths and the unique needs to a specific cohort, rather than taking the entire school in one go. And additionally, what it'll do is kind of help you better understand the data and possible trends. And again, by doing that, you are able to provide equitable supports. So for example, think about a school-wide screening effort may reveal that, you know, you have a few teachers who have identified 30 to 40% of the students in their classroom are kind of having more intensive social, emotional, behavioral needs. So rather than having teachers individually follow up with those students, what they can do is provide classroom supports as like a group to kind of help navigate those behavioral management issues. So again, like providing group SEL. So there are definitely benefits for starting small, because that way it'll kind of help you be in more control and help kind of navigate with the given resources that you have. Okay. The next one is identify students with the highest well-being. Now, remember, screening is beyond identifying risks or challenging experiences, meaning that it can always take a strengths-based approach. When you do focus on the positive things, it can actually help reduce some of the stigma around asking, you know, youth especially about mental health or, you know, the challenges they're experiencing within the school setting. It will also empower students and also like increase their self-esteem, because who doesn't want to talk about the positive things, right? And there's kind of more buy-in to responding to those. Also, given the fact that only 20% of, you know, students who experience clinical levels of distress in a given year actually seek treatment and continue treatment, having kind of a positive well-being approach will actually help reach out to more students. And also, when you think about obtaining consents from caregivers to screen their children, this can kind of be almost a barrier, because, you know, we have seen that parents may be reluctant to provide consent if we are going to talk about critical and very sensitive topics, and that's understandable. So how do we kind of think about that and create a more positive approach so that we can get more buy-in? So again, focusing on positive things could be one way to address that. The next one is identify students at risk for mental health illness or harm to self or harm to others. Now, different schools, again, have varying reasons to screen. So that means, you know, some of the goals to screen are different given the school. So this could include, you know, some schools may find themselves having a lot of referrals and a lot of suicidal ideation and homicidal ideation. So their goals to screen may be different, and that could be to identify students who are currently at risk, versus other schools maybe in different places and have different goals for screening. So I'll speak about goals for screening in a couple of minutes, but this is also another reason why schools prefer to screen. The next one is improve access to mental health support. Now, this kind of also ties back to the stigma tied to mental health and the need for more awareness, which, you know, doesn't really come as a shock to most of us, but only a fraction of students and their families actually get mental health care. it's not only tied to the stigma, it's also tied to language barriers. It could be tied to financial needs. It can be tied to logistical issues like getting to community clinics and so on and so forth. So by screening and providing that option in the schools, you're really creating more access for students from such beliefs and backgrounds to have more of that support and to have their needs met. The last one is economically sound. So conducting systematic screening can not only help schools move away kind of from the Band-Aid approach to their service, but also economically benefit them long term. So think about the intensive mental health care options such as emergency department care, inpatient hospitalization. So a lot of those things can be addressed on the front end if universal screening is implemented. Because like I mentioned before, you were able to detect and identify students who are at risk way ahead of time before things get escalated. Okay, so this slide talks about, and the future slides will kind of keep explaining and breaking down this series of steps. So this is the screening action steps. I'm going to give you a minute to kind of review this slide. So screening is a comprehensive process. It involves several steps beyond just administering a screener. And because of that, it can, sometimes become very overwhelming. This again goes back to the resources that different schools have to implement screening and how you decide to implement it. But regardless, it can be overwhelming because there are a lot of things to think about. But it doesn't always have to be that way, because your school's well-being team can really strategize and put in place a systematic plan to successfully and effectively screen. Now, I'm gonna very briefly go through these steps, but again, you can always access the full recording through the link that we shared on our flyer. So the first one is build a foundation. Once you build a foundation, this is kind of like your team who will kind of navigate the whole screening process. Then you want to have your goals to screen. Like I mentioned before, different schools have different reasons they want to screen. So what are your goals for screening? Then given those goals, kind of look back and see what resources that you at your school has. Like, can you match your goals with the resources that you have? And do you think it's realistic that these goals can be achieved? Then once you do identify the resources, then you select an appropriate screening tool. There are various screening tools, mostly free of charge, but there are some schools who prefer to get certain packages of screening tools at a cost. So there are so many different options that schools can pick from. Then after you do pick a screening tool, the next thing you have to think about is how do you obtain consent and assent? Like I mentioned before, parent buy-in is a critical component of screening. The more buy-in you have, the more likely we are to get consent, and the more likely most to all of our students will be screened, because we do want to capture all of our students. And the last one is, once you have consented, how do you now administer this? Have a data collection process in place, analyze the data, and also follow up on those student needs. So this is kind of like the whole action series steps for how to screen. So let me go on to building a foundation. So building a foundation, it's kind of like self-explanatory. So these are kind of the components that fall under building a foundation. So you want to have a team. you want to generate engagement and support from the community, from the school, you have to think about the cultural considerations. You have to think about how you want to use the data, and also we'll talk about surveillance data. So when it comes to assembling a team can really consist of, just like your well-being teams, you can have a screening team. Sometimes members in the well-being team can be a part of the screening team. Sometimes they can be a completely different team who have interests in mental health of students. So there are kind of different ways that you can compile a team, but again, it depends on how much support, how much resources you have. So it can really comprise of school admin and staff, community providers or members, students, and also family members. And the whole goal of this team is to ensure that all of the screening processes, pretty much the action steps, are planned. They're also responsible for administering screening measures, including interpreting in other languages. So again, the cultural considerations come into play. How do you, they also need to consider how you score the responses once they come in, and how do you identify students who are at very high risk. And also, how do you coordinate follow-up support? So how, if you are planning to refer out students to the community, how do you do that? And one of the first steps to do that is to have a team of community providers. So your school mental health screening team is kind of responsible for managing all of that processes. So the next one is generate engagement and support. Excuse me. So when you do generate engagement and support, it's just like getting caregiver buy-in to screen their students. You need to gather input, thoughts, and goals from other people in the community or other people in the school community that's outside your screening team, because everyone brings a unique perspective, and they may have important or interesting ideas that you haven't thought about. So it's always good to check in and engage other people. And it doesn't always have to be a conversation or a meeting. It can be surveys. It can be anonymous feedback cards. So if you really want to be creative, there are different ways that you can do it. The next one is cultural considerations. So cultural beliefs about screening, the mental health stigma, and so many other issues like the stress tied to immigration, poverty, languages. These are all things that you have to consider if you want to not only successfully screen, but also equitably screen. So it's really critical to think about how schools can make screening more acceptable to various cultural groups in their school community, and also like the families that they cater to. The next one is use data. Now, data can really support justification for mental health screening. And data can also help, connect the dots or lay out different patterns for other challenges that students present with. For example, you have a certain group or certain number of students who kind of have regular absenteeism, regular tardiness, consistent low grades. So if you really are interested in understanding in depth, like what's going on for these students, screening can kind of help supplement that. The next one is surveillance data. Now, surveillance data will really help you gather insight into the current mental health performance of students. It's not essentially screening, but what it does is it gives you an estimate of the mental health status and the behaviors of your students. And that can kind of help you guide screening data. So for example, it can give you an estimate of how many students may be engaging in substance abuse. And having that number is going to be really helpful when you actually screen, so that you can have the necessary supports and resources in place. And that way you're not kind of gathering them after you screen, but you have this surveillance data that kind of help you estimate the trends before you actually screen. The next one is clarifying goals. I'm going to go I'm going to try to talk a little bit faster because we're exactly at 9:30. But again, if there are any questions, feel free to reach out to me, or you can always review the pre-recording of this one. All right, so the next one is clarifying goals. Now, creating and clarifying screening goals have to happen prior to, of course, selecting a screening tool, like you see here on this flow chart. And then once you do clarify, your screening goals, it's very important to communicate those to your entire team so that everyone's on the same page. We will quickly review some examples of what screening goals may look like. So you want to have a screening goal, but then you also want to have a desired outcome. And it's imperative for goals to be very specific and also data-driven, so that you know why you're screening, and kind of the desired outcomes you're expecting. So let's look at these examples. I'll give you a minute to read off the slides. All right. So the first one is screen all 6th grade students in one district for anxiety. Now see how specific that goal is, and see how it really focuses on a grade and not the entire school. And it also focuses one district and one concern. 6th grade students, one district for anxiety. So I just want to emphasize that, because when you do create goals, try to be as specific as possible, because on the back end, it will really work to keep things organized. To inform who may benefit from additional support during the transition to middle school. So your outcome is you want students to transition smoothly into middle school. And your goal is all 6th grade students in one district for anxiety. So I just want to emphasize here that you have to have a goal, but it's also helpful to have a desired outcome. So there's always like this direction. Why are we screening students for anxiety? And the response would be, well, we want them to transition smoothly to middle school. So they kind of go hand in hand. The next one. Screen all 9th grade students in one high school for depression, including suicidal thoughts. So that's your goal. And why do you want to do that? Because you want to improve identification of students for counseling and also inform kind of the school-wide suicide prevention efforts. The next goal, screen all students in one district for school connectedness. Now, this is kind of like capturing a bigger population compared to just one grade. You want to screen all the students, but just focus only on one district for school connectedness. And the purpose of that goal is to identify which schools out of that district have high rates of school connectedness and learn from their efforts to improve this in other schools. So this is also kind of an approach for schools to learn from each other. So that's their purpose. So this is I just wanted to take a minute and review this, because I think these are very helpful just to give you all an idea when y'all are planning to create your goals and outcomes. Okay, the next one is identify resources and logistics. So before any screening, it's critical that teams access or kind of review what resources they have and the capacity of those resources. So say that they have 3 school psychologists. What's the capacity of those school psychologists? Because they have so many other roles to perform in the school. So it's not only the numbers, but also as individuals, what's their capacity? Now, one way to do this is to collaborate, of course. Always talk to your school staff, collaborate, communicate, and come up with a plan. Communication goes a long way. Screening is not a one-person one-person plan. It takes a village to actually successfully screen. So once you do identify resources and logistics, I want to give you an example. So think about teachers and paraprofessionals. I took school psychologists as an example, but I also want to talk about teachers and paraprofessionals. So they have a continuous role throughout the school day to provide academic instruction and behavioral instruction as well. But what they can do in terms of screening is that they can help support the administration of the screeners, just because they're always in the classroom. And that's kind of one way to not really put extra responsibilities on them, but kind of like work with what they can do and what they're already providing. So that was another example. Community providers, that's another kind of resource that you can tap into. They can help with coordinating follow-up support. So like once you do screen, they are the people who kind of take over. If you do have students with critical needs that the school cannot provide, or the school is tapped out, they are the persons who can like really help follow up, take new referrals, and work with the school team to kind of manage the caseload. So just a couple of examples. Now, when it comes to logistics, this is kind of where the technical support comes in, because when you are implementing screeners, you can do paper pencil, you can do electronic format, whatever process that schools pick. It is important to think about how are we going to collect the data and how are we going to analyze the data. Again, even if you do manual or electronic, there needs to be a way that you can take that data and integrate with the existing school data systems, like absenteeism, grades, tardiness. So again, different schools are in different places, their resources are different. So however you do choose, these are some things to think about. Okay. So the next one is selecting an appropriate screening tool. Again, like I mentioned before, there are so many tools out there. Some are free to use, easily available on the internet. Some you need to purchase at a cost. Some come in one language, some come in more than one language. So these are like all of these things you have to think about. Now, this slide kind of walks you through some of the things you need to think about when you select a screening tool. And some of the general things that school teams need to think about are, is the screening tool compatible with the purpose of screening? So remember your goals. If you want to screen a school for anxiety or a class for anxiety, does the screening tool kind of capture that goal? So that's one thing. Have kind of a theoretical and empirical support for psychometric properties. So is it reliable? Is it valid? Is it evidence-based? Can you use the screening tool with your current school population? And that's kind of where the cultural consideration comes into place. So these are some, you can read the rest of the slide. Some important things for you to think about when you do pick a screening measure. All right, so the next one is determine consent and assent processes. So once you have selected your screening tool, now we have to decide how are you going to consent and how are you going to assent. Now, in our experiences, one of the most important things to think about at this stage is what are your state and school district policies when it comes to consenting? This really is different across all the different states. Schools also have various different policies when it comes to consenting. So it is important for the school mental health screening team to be very, very familiar with what these processes are on the front end, just because after you do things incorrect, it's very hard to go back and change things. It can really disrupt all of the hard work that y'all have put into screening. And also just like thinking through a litigation standpoint, these are things you want to avoid. So make sure to be very familiar with these policies in your school and state. Okay. So this table here kind of gives you a snapshot of the considerations, but again, please do consult with your state and school policies. Now, as the screening team decides on consent procedures for their school, in addition to state policies, in addition to school policies, think about timelines. Think about FERPA and HIPAA. How do you handle such information in confidential ways? So this table really defines the different kinds of consents. It kind of talk about the strengths and also the limitations. But again, there are some schools who only prefer, or some states who only allow active consent and not passive or opt out, versus there are some schools or states that will allow kindergarten through 6th grade needing active, and then the remaining needing passive. So there are like these different interesting combinations, but always go back to the policies. Now, one more thing is, after all this careful planning, you want to reach out to as many caregivers as possible to obtain consent. And you want to be able to follow up repeatedly if you haven't got a response. So think about all of these ways that you can actually get the word out that you are going to screen. Help caregivers be familiar with what screening is. It feels very different when parents haven't heard about screening at all and suddenly get like a consent form through their child's school file asking to sign, versus talking to parents about screening, sending out flyers, talking about this during back to school nights, during parent teacher conferences. Having those kinds of steps in place can really kind of change the response rate of consent. So it can be, you can get really creative in how you want to reach out to caregivers about these things. It can be automated phone calls. It can be automated school texts, put information on the school website, send traditional letters in the mail, flyers home, forms and sheets through registration packets. So there are really multiple and numerous ways that you can get the word out and kind of increase awareness about screening. Okay, and the last one here. So once you have your school screening team put in place, clarify goals, identify your existing resources, select an appropriate screening tool, obtain consent and assent. Now it's about developing a data collection process, administering your screening tool, and also following up with those who need more intense support. So this is your last step. Now, again, I kind of did touch on this throughout the presentation, but when you do develop data collection systems, this kind of talks about, do you want to do paper and pencil, or do you want to do kind of the electronic format? You have Qualtrics, you have SurveyMonkey, you have RedCap. So think about like the resources you have in your schools, because if you do use electronic formats, there are some tools that are already set up in those systems that you can just create an account and like start administering. But then there are some things that you have to like take and put it into the system, like type out the questions and things like that. So when you do that, you want to think about getting permissions from the authors of the screening tools. So those little things that that you could miss to think about. And administering the screening. So how do you want to administer this? There are different ways that you can do this. You can have teachers take a single class period and have students all completed. If teachers are completing on behalf of the students, incentivize your teachers for taking that time to do that. It could be a planning period. It could be asking them to come a little bit early, but again, incentivize them, bring them breakfast and coffee. It goes a long way, and it really helps the system to kind of like keep us doing this work. So these are some little things to think about. Okay, so with that, we are at 9:47. So I am going to actually just base this discussion on this single discussion question. Now, to what extent did your district or school use best practices for mental health screening, planning, and implementation? Now, I'm going to kind of talk about some of these best practices, and it's going to reflect all of the things that we have, I have discussed in the last 50-ish so minutes. I'll give you a minute to read this slide. So think about the best practices for screening. All right, so again, just like if you did join us for our second module, or if you have had the chance to read the recording, which was on teaming, something that we emphasized was include families and students in your school mental health teams. And just like that, include your students and families in the screening process. And this goes a long way, especially when it comes to obtaining consents from caregivers to screen students. Like I said, no parent is going to want to sign on a form that just appears on one day about asking, can we talk to your child about mental health concerns? So one way to be proactive is to kind of include them in the conversation continuously. The next best practice is to pick a screening tool. And when you do pick a screening tool, you want to think about the psychometric properties, but then you also want to think about what your goals are. What are the costs looking like? Like I mentioned before, there are psychometrically sound screening tools that are freely accessible. So with your screening team, do some research. Speak to your community providers because they may also be using screening tools that you may not know about. So those are some things to consider. Next thing, share information about screening in multiple formats. So this is kind of what I spoke about. If you want to reach out to your caregivers, do so in consistent ways and also in creative ways. Beyond just sending a single consent letter at home, put it out on the website, talk about it during back to school night, parent-teacher conferences. So speak about it with your students as well, because of course students, discuss things with their parents. So it's kind of like little ways to share information in effective ways. The next thing is inform students and families about the screening procedures. One of the things that you want to do is explain to caregivers what screening is. What does it look like? And a really good example that we at the Utah School Mental Health Collaborative talk about is screening for mental health is just like screening for vision concerns, just like screening for hearing concerns or reading. Those kind of happen routinely with the school nurse or with the reading specialist. And just like that, school mental health screening is also something that we want to do routinely. And kind of talking about this really kind of also helps combat some of that stigma. Next one is to roll out initial screening efforts gradually. I cannot emphasize more, always start small. Start it as a pilot, could be a single grade or a single classroom with maybe 15 students. Implement it, see what has worked, see what hasn't worked, and how we want to do things differently. And starting from that, you can keep expanding eventually. And I also want to say, so screening takes a lot of planning, like I mentioned before, the action steps. So it's not something that you can think about today and do next week. It takes a lot of intention. So again, it's a gradual process. So always try to work backwards. If you want to screen in 3 months, always work backwards and kind of see what your timelines look like. The next one is respond to risk of harm to self and others immediately. So again, like I said, you need to plan out your screening process effectively. Once you do screen and you feel there are certain students who are at imminent risk, you want to address it as soon as possible. So having your community providers in place to take in new referrals is going to be critical. And the last one is have a process to assess screening results to triage students to appropriate services. So in addition to those who are at imminent risk, you will also encounter through the responses, there are certain students who are not currently experiencing challenges, but could be, or you foresee the kind of trends that could lead to that. So you want to, again, have a process of how you could be proactive and prevent those things. So have like a triage system to have them receive those appropriate services. Okay, I'm going to also focus on this. Now, like I said, screening can be really, really overwhelming. And I want to kind of talk about some of the very common challenges that schools experience when it comes to implementing school mental health screening. And along with the challenges, there are also some suggested solutions that schools can consider to address those. So I'll give you a minute to review this slide. Okay, so on the top row there, you see some of like the very common barriers that schools experience when it comes to screening. And often these are some of the reasons that a lot of schools want to avoid screening as well. And we do understand because there's a high shortage of school mental health providers. So schools are really trying to work with the resources that they have. So one of the concerns are the identified need will exceed our capacity to provide resources to those who are going to be newly identified through screening. So some of the things that schools can consider to address that concern is to set triaging data rules in advance. So once you do screen, schools can initiate their own cutoffs about who gets referred to what service. Because a lot of the screening tools that are out there, schools can use local norms. So local norms are kind of norms that fit within your school rather than using kind of the more national norms. Because again, every school is unique. They have their own set of resources. So it doesn't seem equitable to use national norms to compare. So schools can use local norms, and in that way, they can kind of set their own cutoff scores or kind of those rules for triaging who gets what service or who seems to be at risk and who does not. The next one is review existing resources and capacity. So again, identify the providers that you have in terms of resources, and after that also assess their capacity. You may have 10 school psychologists and they may be all capped out. So that's why you have to think about your resources, but also their capacity. Review surveillance data. So this is kind of where you can estimate before you actually screen. You can estimate kind of the trends of challenges that your students experience. And as a result, you can carefully design your goals. So for example, through the surveillance data, if you identify that the trends are a lot of students are at risk for anxiety, that'll kind of help you create effective goals, choose effective tools, and have resources identified, because you know this is coming and it doesn't kind of catch you off guard once you screen. The next one is, of course, start small. It's always a good place to start, and then you can adapt and scale up. I wanted to actually go through this first barrier because this is a very common concern that we hear from a lot of the schools. But there are also other common concerns that schools may experience, things like community buy-in or obtaining consents from parents will exceed our capacity, and what will be screened for. So there are definitely ways that you can address these. And even though I'm not going to discuss this in detail, please do review the module 4 MHTTC recording for this topic, because they do kind of go into depth about how, and talk about how you can address this, but also they do give you so many resources that you can access. So with that, we're almost at the top of the hour. That kind of brings us to the end of module 4. I did tell you this was my personal favorite, so that's why we're kind of cutting short on time. But thank you for joining us today. Please do join us on the first Wednesday of next month to talk about mental health promotion. We will see you next month. Thank you for joining us. And if you're interested, do follow us on social media.